March is National Colorectal Cancer Awareness Month. Did you know that colon cancer is the third most commonly diagnosed cancer and the second leading cause of cancer death in men and women in the U.S.? Joining us today to talk about the symptoms and treatments of colorectal cancer and what you can do to prevent it is Dr. Meredith Maxwell, family physician of Crescent City Physicians of Truro Hospital. Thank you for joining us today, Dr. Maxwell. Can you tell us a little bit about colon cancer?
Sure. So colon cancer is a type of cancer either found in the rectum or the colon, usually more found in the colon than the rectum, about 70-30 respectively. It usually happens in older people, about 90% are greater than 50 years old. It does not vary versus men versus women, ethnic groups. So it's really important to know how to prevent it and to know that your facts, your risk factors.
And what are some of those risk factors?
So being greater than 50 is one of them. A family history of colon cancer, a personal history of any type of cancer, a history of colon polyps, which can be found on your screenings that you get, every 10 years or whatever you and your doctor decide. Being unhealthy with your diet, there's some studies that show it varies from diet to diet depending on how much fruits and vegetables you have. A history of smoking is also a risk factor for colon cancer. So those are just a couple. And knowing your family history is extremely important when you go to your doctor.
And what can an individual do to help prevent colon cancer from developing?
Well, one is live a healthy lifestyle. So a diet with high fruits and vegetables, less fats, especially animal fats, high fiber have been shown to make a difference. Of course, stop smoking if you're a smoker. Knowing your family history, so a first-degree relative, meaning your brother, your sister, your parents, even your child with a family history of colon cancer, that can actually move your screening date forward, depending on the person, of course. So getting routine screenings and keeping up with those. So if they change it to every 3 years versus 5 years versus every 10, being very compliant with those screenings is a huge way to prevent colon cancer.
And when should an individual start thinking about going to their doctor and talking about preventing colon cancer or screenings for colon cancer?
Well, I tell my patients to come every year so that I can make a personalized, depending on their family history, their risk factors, as to when they should start. So it's not just kind of routine in everybody. Most people start at 50 because, like I said before, 90% of colon cancer happens after 50. However, you need to work out when you need it with your doctor because it may change depending on your family history and your risk factors.
So it should be individualized with your doctor?
As all screening should be.
And then what are some of the treatments for colon cancer, or is it even treatable?
It's very treatable, actually. There's about 1 million colon cancer survivors in the United States alone. Of course, the earlier it's found, the better. Colonoscopy is not just a screening treatment. It also can detect polyps, which are precancerous lesions that can develop into full-blown cancer. So when they go in, they actually can remove the polyps, send it to biopsy, figure out if it's bad, if it's just benign, and they might change your colon screenings depending on that. So, it's not only the screen, but it's also a treatment. There has been surgical procedures, even when it's spread into the lymph nodes and progressed a little bit, that you can kind of remove the colon surgically and get chemotherapy, and it's very successful if you don't let it grow long enough. So the sooner you get these treatments, the sooner you find it, the more success you'll have with getting better, treating, going into remission, that kind of thing.
So colon cancer is actually curable?
It is. It is. It all depends on when you find it, however.
Is there anything else that you would like to share with our public?
Yeah, know your body. Watch your bowel movements. Any frequency alternating bouts of diarrhea, constipation can be a symptom. Any blood in the stool. I do stool cards on my patients every year in between colonoscopies to look for microscopic blood in the stool, which is a good idea because that can actually be a risk factor as well. Weight loss, any nausea, vomiting, those kinds of things are things that you want to look for with colon cancer. So definitely talk to your doctor if any of those things come up.
So some of the signs to look for would be any kind of change in your stool.
Right.
And weight loss or any unusual symptoms in your abdomen.
Like nausea and vomiting, weight loss for no apparent reason, blood in the stool, change in caliper, thinner stools, change in what's normal for you, your baseline.
This is wonderful information, and I really appreciate you being on our show today. Thanks so much.
Of course.
And we'll be right back with more Community Health Heroes. Did you know that you can possibly save someone's life by performing CPR before EMS arrives? Here today to talk about the importance of performing CPR and how you can learn to save a life is Mike Gilliatt, Director of EMS at East Jefferson General Hospital. Thanks so much for joining us today, Mike. I heard recently that 4 or 5 heart attacks happen at home. Can you comment on that?
A lot of my heart attacks happen at home, and unfortunately, a lot of times it's during holiday season, special events. A lot of times heart attacks even happen during the night, when waking somebody from their sleep. So I guess the answer is they can happen anytime, but unfortunately, a lot of people are at their residence when they occur.
So when should a person perform CPR?
CPR should be performed by anybody who collapses in cardiac arrest, or they suspect is in cardiac arrest for the layperson. It's often hard to determine sometimes how long a person may have been in a cardiac arrest if they find them, if they walk into a room and they don't know if the person has been down for a while. But if there's any doubt as to whether to start CPR or not CPR, it's always best to start CPR, unless, of course, somebody has a clear advance directive not to have CPR resuscitative measures performed on them, such as a hospice patient or somebody like that.
And what should you do if you suspect somebody is having a heart attack?
Anytime a suspicion of a heart attack or any medical emergency, the first thing somebody should do is call 911. Immediately call 911. It triggers a number of resources that are en route to you. And then the next thing you want to do is be ready to assist the patient in any way that's necessary, but also sometimes be listening for a callback. A lot of times our medical dispatchers in this region will call back to the residents and maybe ask a few more questions about what is going on with the patient, is the patient breathing, and they can often offer some common instructions for you at home to do pre-arrival to EMS getting there. Such in a heart attack situation, our dispatchers may instruct you to give the patient an aspirin to chew, which could be very beneficial to the person having a heart attack.
That's very good information. And a lot of times people say they're afraid that they're going to hurt the person that's collapsed. What would you offer for suggestions about that?
I always take a common sense approach to that. If somebody is unconscious, they're not breathing, they don't have a pulse, you can't get much worse than that. So doing CPR and doing chest compressions is so important, because that may enable that person to be resuscitated if they are truly in cardiac arrest. And years ago, the American Heart Association took out, for the layperson, the pulse check. Because a lot of times when somebody goes up to somebody unconscious, unresponsive, and they're not a healthcare provider, and they don't check pulses every day, et cetera, and they assess a pulse on somebody, and they may think, oh, I feel something, I don't feel something. They were reluctant to start CPR, reluctant to start chest compressions, because I don't want to hurt the person. Well, the Heart Association has taken that completely out of the scenario for instructing lay people in CPR, because they were finding a number of false positives with that or false negatives with it. And the person looks unconscious, they're not moving, they're cyanotic or blue in color. Starting chest compressions is the best course of action.
Mm-hmm. And if our audience would like to know, where can they go to learn CPR, what kind of places would you suggest?
A number of communities offer CPR, either through churches, schools. The American Heart Association is a great resource for a number of these community classes being taught. Often, if you see in a newspaper, churches, at the hospital, at East Jefferson Hospital, we offer CPR courses for both the public and for healthcare providers. So it is something that a lot of organizations are engaged in the instruction of for the community.
Is there anything else you'd like to share with us today, Mike?
Main thing is that if you suspect someone's having a heart attack or any type of medical emergency, don't hesitate to call 911. CPR can truly save somebody's life. Emergency services, often we're 6-7 minutes away, but in a situation where somebody is in cardiac arrest, minutes truly count. And believe it or not, that the person who does chest compressions and does the basics is truly the one who saves their life. We find that more and more resuscitations are coming from effective CPR and early onset of CPR, because that buys time until defibrillation can get there from the first responders. So the person who does, if you choose just to do hands-only CPR, but just doing chest compressions alone, that would truly make a huge difference in the outcome of the patient.
Well, I really appreciate you taking the time to come and share all this information with us. Thanks, Mike.
Oh, thank you for having us.
And we'll be right back with more Community Health Heroes. Welcome back. Our next company has found a way to perk up the health of its workplace by instating a wellness program for its employees and their spouses. Joining us today to talk about their successful program and how they are helping their employees remain healthy and productive is Summer Mason, Senior Total Rewards Manager with Community Coffee Company. Thank you for joining us, Summer. Can you tell me about what prompted Community Coffee to start a workplace wellness program?
Sure. Community Coffee is a company of values. So our values are very important to us. And of those values are our people. And with our people, we want to encourage healthy lifestyles and for them and their family. So with that, we looked at incorporating a wellness program. And so we're happy to be able to have that program in place to encourage healthy living for employees and their families.
So Summer, tell me about your workplace wellness program at Community Coffee.
We have several programs in place. The first one is we have an HRA, which is a health risk assessment. And the health risk assessment is an online questionnaire that employees can get online, fill out a basic questionnaire about their health. And the second piece to that is a screening. So they can go out and have a health screening done. And then another aspect that we have in place is for one-on-one health coaching with an RN. And so with that, those coaches can then get the information from the health risk assessment with the screening and then also claims on the back end from the benefits claim system. They can then take that information and then sit down with the employee and coach them on health and wellness and things that they need to incorporate in their lifestyle. In addition, we also have other programs that are in place, such as walking programs. We implemented recently a pedometer walking program. We've also had some on-site presentations, such as healthy eating, exercising programs. And so we've had those at the office there, having dietitians and people coming in to explain and go through those type of programs with them and working out those details. And then also we have an online digital coaching program as well. So employees can, and their spouses, can go online and actually get digital coaching online. So if they can't sit down and have that one-on-one session with the coach, then they can go online and go through a digital coaching session. So there's multiple avenues that we can actually have employees go through the wellness program and gain access to our program.
And the online makes it easy for people to work around their busy schedules too.
Correct. So we have a workforce that is throughout the United States, and so they're not always able to sit down with an RN to get that coaching. And so that online access allows them to be able to get that wherever they are.
About how many employees and their spouses and family are involved in this program?
There are about 700 or so, involved in the program. There are about 700 that are on our plan, and about 75% are somehow involved in it, either through a smoking cessation or participating through that type of program, or through the wellness piece, which I was just mentioning, doing a screening, or that aspect of it.
And how successful has this program been?
It's been very successful. We have a lot of employees that are wanting to participate to get those rewards, because we do have rewards that they can achieve by participating in the program. So we do offer premium reimbursements for their benefits, and so with that, that's that carrot that we're able to get their involvement. So it's been very successful.
So Summer, can you tell me what the benefits to Community Coffee has been from instituting this workplace wellness program?
Community has seen some great improvements to implementing this program. One, you have, of course, some employee engagement and participation in the program and excitement there, so there's some great strides there. But then also you see on the employer side, you see some, or expect to see and hope to see some reduction in your benefit cost. It is early on. It's been in the first year of implementation, so it's early on, but we have seen already trending in the right direction. We've seen some improvements in claim costs, and so we're hoping that's what it's attributed to, of course. And so we're going to continue to watch that, trend it, and tweak the program as we need to make sure that we're heading in the right direction. And also, it's very important to have that executive involvement and leadership, and we've had that as well. So without that leadership and involvement, it's hard to have a program succeed, and we're very lucky to have that executive leadership that's involved so much to where they're really driving that. And so with that leadership, we're able to have a good core program. And so we've seen some great responses internally within the organization and from employees and also financially.
So it sounds like the buy-in from your leadership has really encouraged the employees to get involved too.
Yes, so much as the fact that they're actually leading by example. For example, an executive that is participating in the Crescent City Classic, and so he is actually advertising it, per se, to employees and having them participate in the program with him and encouraging participation. So yes, we do see that, and they were actually a big driver in encouraging the healthy eating and putting in the healthy snacks. And for example, for birthdays, we have put in, like, instead of the traditional cake that you may see, we still have that occasionally, but it's, because we encourage moderation. We don't want to totally, say you can't ever have anything, but we encourage moderation, and so we'll put in like a fruit bar or something, a healthier option, and so those are some things that they've encouraged as well.
And if what other, some of our clients out there are interested, how can they find out more about workplace wellness programs?
I would recommend, and Community Coffee would recommend, that you look at some of your local or national agencies that are available. Those type of organizations will have a lot of information that are available, so reaching out to those local and national agencies. Also looking at the having a strategic partner is very valuable. We work with our third-party administrator and also our broker, our benefits broker, to bring in a strategic partner, and that's very important because when you have data that you're working with on wellness, you're having protected health information for employees that you're having access to, and so you need to make sure that you're protecting that and that you have that strategic partner that's managing that data, and that you're not, as an employer, you're not the one that's actually managing that data. So it's very important that you have that strategic partner to help you not only navigate the data, but also to provide the best programs and consult on those programs.
And really individualize it for the particular company you're working with.
Exactly. So, and there may be needs based upon the data that you're retrieving back. There may be needs that are specific to your organization, such as a diabetic program. So, there are 5 metrics that we test on, and those, there may be something that we need to look at. For example, we look at blood pressure, we look at, we look at blood pressure, waist measurements, we look at triglycerides, we look at HDL cholesterol.
And glucose, probably.
And glucose. And so we look at those 5 measurements, and with those measurements, we're able to then work with them and say, okay, is there something do we need to put in a diabetic type of program? So what exactly do we need to build based upon the needs of our employee population?
Now, do you have like a kitchen for your employees?
Yes, we do. We have a kitchen at the home office. We have a kitchen at Community Coffee, and within that kitchen, we originally had, when CC's was part of Community Coffee, we had a lot of the bagels and those type of things. And so one of the things that we've incorporated was actually pulling out those items that may not be, the healthier type items, but looking at some of the items that would be some healthier choices. So we've pulled out some of those items and then put in some of those healthier choices. So we've put in, the yogurts and the cheeses and those type of items. So we've allowed to put in some healthy items for employees to choose from.
Well, some of this has been valuable information. Is there anything else you'd like to share with our audience?
No, I think that if there's a wellness program that companies want to put in place, then just reaching out to some local organizations and working with a strategic partner, I think will help. Absolutely. But that's pretty much it.
Absolutely. Well, I really appreciate you being on our show today, Summer. Thank you so much.
Thank you. I've enjoyed coming.
All right. And we'll be right back with more Community Health Heroes.